The topic that I'm going to be talking about today is called What Your Cardiologist Doesn't Know About Sunlight and Heart Health. As Simon mentioned, so I'm a general practice registrar. I have had training in public health, and I host the podcast that seeks to break down a lot of these issues. I want to make a comment about some disclosures, and I think this is important because our personal, our intellectual, and our financial interests are going to affect what I tell you. And in decentralized health, where everyone has to make up their own decisions in their own mind, this type of information is important. So I personally do a low carb and cyclically carnivore diet. I do deliberate sun exposure, and I take zero medications or any type of supplements. And I am not sponsored by any company, any organization, and I have some Circadian health brands that I'm work with, and obviously providing educational content, promoting these lifestyle interventions to great success. When I was flying down to Melbourne for this event, this post came up on Instagram, and it reads, "There's deadly sudden cardiac arrests soaring in Victoria," and this was on the 19th of April. And look, there's a range of component causes that are always going to go into heart attack, and that is exactly the topic that we talk about. Some of these I don't think history is going to smile or look back fondly on, but the topic and the relevance of what I'm going to talk about today, this really emphasizes. So an interesting observation that I want to discuss is that people who get more sunlight have less heart disease. And a study that was released in 2016 in a Swedish population, I think illustrates this point more than anything else. So the title of the paper was Avoidance of Sun Exposure as a Risk Factor for Major Causes of Death in this melanoma in southern Sweden cohort. So what they did is they enrolled 25,000 middle-aged Swedish women. They asked them 4 questions. Do you sunbathe in summer? Do you sunbathe in winter? Do you ever visit a tanning booth? And do you ever travel overseas to tan? The premise of this study was, or the hypothesis was, that women who had deliberate sun exposure were going to die more frequently of melanoma particularly. So what did they find? Well, they actually found the complete opposite. So the survival of those who had the most active sun exposure was double that of those women who routinely avoided the sun. And you can see the same thing illustrated in all-cause mortality. So the conclusion that the authors came up with in this paper was that women who avoid sun exposure are at an increased risk of all-cause death, with a 2-fold increased mortality rate compared to those with the highest sun exposures. So this is a very, very significant and large effect size. What else did they find? They found that the women who smoked but had the most active sun exposure habits had the same mortality as those women who didn't smoke yet avoided the sun. And they found that sun exposure was a risk factor for all-cause death of the same magnitude as smoking, and that was a novel finding, but in agreement with systematic reviews of vitamin D and the risk of cardiovascular disease. So what else? They found that the cause of death, although they did not investigate it, was likely to be attributed to cancer, heart disease, and cerebrovascular disease, which is diseases of your blood vessels. There is a known seasonal variation in both heart disease and cerebrovascular disease, stroke, with increased risk during winter, spring, as compared to summer. So the question is, something about the sun is reducing likely the incidence of these cardiovascular diseases. But that is not the only finding or paper that has found this result. More recently, and this is still a preprint, a paper by Professor Richard Weller, higher ultraviolet light exposure is associated with lower mortality, analysis of data from the UK Biobank. This is almost 400,000 people in the UK. They followed them for a median of 12 years, and they've managed to ascertain their UV light exposure both by self-reported and via their latitude. What they found is that those people who got more UV light had lower risk of death, lower all-cause mortality, lower cancer mortality, lower cardiovascular mortality. They also had lower skin cancer mortality, and keep that in the back of your mind for the end of the talk. The effect size was approximately 50 days of extra life for those who got the most sun exposure, and about 16 for those who lived at a lower latitude. So the question that we have to ask is, how can we understand this profound benefit that we've noticed for sun exposure on cardiovascular diseases? And now I'm going to be talking about the specific mechanisms that I believe are critical to underlying this observed effect. So this is your cardiovascular system. It is made up of a network of veins and arteries that are delivering deoxygenated blood to the heart and oxygenated blood throughout your arterial system. Simply, cardiovascular refers to the heart and the blood vessels. I want to describe to you the specific anatomy because it's going to be relevant to how this pertains to the sun. So what you've got is, imagine if you cut a garden hose in half and you looked at its cross-sectional area. So you have on this cross-section your endothelial layer, and this is only one cell thick, but it is critical to maintaining the overall health of your blood vessels, and it is critical for understanding how and why we get cardiovascular disease and atherosclerosis, which is the major killer in society today. And again, just another view of that same concept. What is noticeable and something that most cardiologists will not appreciate is that there is something that sits above that endothelial cell layer, and it's called the glycocalix. And the glycocalix is a bunch of glycoproteins that are anchored inside that endothelial cell layer. If anyone has gone fishing and felt a fish, does it feel smooth, rough, maybe slippery? So these fish have mucins, and they are glycoproteins, and that is the same type of substance that is existing inside this blood vessel. And the value or the reason why we have that there is to protect the underlying endothelial layer and to sense what's going on inside the blood vessel. So it's protecting the blood vessel lining and it's protecting those endothelial cells. As you can see, it's providing this barrier and that is here not allowing the red blood cells to contact. And it contains a whole bunch of very, very interesting and useful molecules. But what about the blood? What is going on in the blood that might be relevant to sunlight's benefit on health? And to answer this question, we have to move. And we have to move from a biochemistry-focused view of health, and we have to start thinking about biophysics. And two gentlemen who are absolutely pivotal in understanding biophysical changes that occur to water are these gentlemen, Gilbert Ling and Gerald Pollack. Gilbert Ling was a Chinese gentleman who emigrated to the US and performed a range of, pursued a scientific career, and his research has led to the development of magnetic resonance imaging, the MRI machine. He hasn't won a Nobel Prize, but probably could have won a couple. Dr. Gerald Pollack is a water researcher from the University of Washington, and he is currently the world's foremost expert on studying water. And notably, his background is in engineering, and that is important because he's really applied an engineering mindset to understanding water. So for a long time, people thought that water occupied only three phases. But what Gilbert Ling and subsequently Gerald Pollack have helped to educate people on and discover is that there is a phase of water that exists that is neither liquid nor solid, and that has been termed the fourth phase. The fourth phase of water is essentially a complete change in the molecular structure that occurs when water simply contacts a hydrophilic surface. So what happens is very, very interesting is that the properties of this water adopt a very, very unique liquid crystalline structure. What happens is that you get a charge separation, and this charge separation means that this lattice structure forms closest to the hydrophilic surface, and the more positive hydronium ions are separated. Whenever we get charge separation, we get a battery, and that charge separation is the fundamental basis of a battery. What else happens is that we exclude solutes. So this process of forming fourth phase water is a very effective way of preventing any kind of solute from essentially getting close contact to that hydrophilic surface. And it's a highly dynamic situation where the size of this exclusion zone is varying. It's being built up and it is condensing. So this is another way of perceiving it. And as Dr. Jalal mentioned, these are lattice-like structures, and it has this liquid crystalline structure. It's also been called exclusion zone water for that reason, and also structured water or coherent domains. So what did Dr. Pollock notice? He noticed that if you took a hydrophilic surface and you made it into a tube and you put it in water, then you would get continuous flow through that tube. And no, this isn't a continuous motion machine because there is an input that is driving this water flow. And we're going to discuss that as we get into the rest of the talk. How is this relevant to the heart and cardiovascular system? Well, it turns out that your blood vessels are hydrophilic tubes, meaning that they form a layer of exclusion zone water, and that is in your arterial and your venous system. So how can we think about that if we're taking a cross-section again? Well, it turns out that you have exclusion zone water that is sitting above your endothelial glycocalix, meaning above those glycoproteins that are protecting the endothelium, you have in a healthy person, in someone with good cardiovascular health, you have a robust layer of exclusion zone water. How can we think about that? Well, just like a maglev train levitates above its track as it goes along the track, so are you essentially providing an almost force field in between that blood layer and the contents of the lumen of the blood vessel. So this is really revolutionary because it completely changes the way we think about cardiovascular disease, atherosclerosis, and the formation of plaques within the arteries. So what else? Why is this relevant? Well, because it turns out that the exclusion zone is not the only charged thing in your cardiovascular system. Your red blood cells carry a negative charge. What else carries a negative charge? Well, it turns out your lipoproteins, LDL cholesterol, HDL cholesterol, are all highly negatively charged. So if you have a negative exclusion zone water in the blood vessel and you have negatively charged blood contents like red blood cells, like lipoproteins, then you have a highly effective way of preventing contact to the underlying cell layer by the contents of the lumen. And this is a biophysical property that exists in all of us that is not discussed in any way, shape, or form by centralized mainstream preventative cardiology who are trying to help you stop having a heart attack. But this is a fundamental reality of how your blood, your cardiovascular physiology that isn't recognized. So what does that mean? And let's play with this idea. So atherosclerosis is going to be a disease related to blood clotting of chronic disruption of your endothelium and your exclusion zone water. So let's see what that looks like. So this is someone healthy. They've got a robust layer of exclusion zone water all through that arterial. And let's pretend this is a coronary artery. Remember, you can form plaque in multiple vessels, but we're really concerned about protecting the blood vessels that supply the arterial circulation of your heart. So if this is a coronary artery and you get a breakdown in your exclusion zone water, then your force field or your maglev ability to protect the glycocalix and the endothelium is compromised. So what happens? Well, you get damage to the blood vessel wall. And when you get breakdown in this system, you will get platelet aggregation, you'll trigger thrombosis, which is the body's way of healing or fixing a damage. And this is an evolutionarily appropriate adaptation to a blood vessel wall rupture. But the problem becomes when that happens chronically, we end up forming plaques because the process of endothelial injury, clotting, and repair is what is laying down coronary artery disease and atherosclerotic plaques. And the progression of plaques, and this has been shown repeatedly on various pathological investigations of people's coronary arteries, is that there's a chronic layering of plaque contents related to subsequent events of clots. So the more this happens, the more the body is trying to heal, the more plaque will form. And people who have coronary artery calcium reflects the fact that the body has, over a period of decades, fixed and tried to heal chronic vessel wall injury, which initially necessarily began with the disruption of that exclusion zone water that lines the blood vessel. What happens if you have this acutely? Well, if you have a large enough thrombotic event, then this thrombosis will occlude your vessel, and blood flow to the heart distal to that point will lack blood flow, and that is when you will have a symptomatic heart attack, which we call an acute myocardial infarction. How do we know that these plaques are related to blood clots? Well, there's one way of finding out, and it's very elegant, which is simply staining an excised coronary plaque. So someone that's been taken out of someone who passed away with a coronary artery disease, and we find a protein that is a unique marker to red blood cells. So this tells us that the process of clotting and plaque formation is related to red blood cells and the accumulation of red blood cells in a damaged blood vessel wall. So what does light have to do with this exclusion zone water and with heart health? And I think that's a very good question. So it turns out, and this is the work of Dr. Gerald Pollack, that light affects the exclusion zone and the formation of exclusion zone water, and particularly infrared light. And he's demonstrated that shining infrared light on the water massively potentiated the exclusion zone. And in a story that is really typical of the serendipity of science, he had an undergraduate student and they were investigating this fourth phase water in the lab. And this curious undergrad who had very little expert knowledge was probably bored, and he took a lamp and he shone the lamp on the experiment that they were doing. And he noticed that the exclusion zone in this experiment was massively potentiated. So what Dr. Pollack did, and again, like Anthony mentioned, all great science starts with a process of keen observation and then explaining the observed phenomena. So Dr. Pollack found that they looked at all these different types of light and they found that it was infrared wavelengths, so longer than visible light, that was most potential and most capable of increasing that exclusion zone. What else did they notice? And this is unpublished research. Wi-Fi radiation. They put a Wi-Fi router next to the exclusion zone. And this is in a model. And they found that it shrank. So what does this mean for the exposure to non-native electromagnetic fields and cardiovascular health? I mean, join the dots. But this is research that needs to be done and isn't being done. So what did Pollack do next? Well, he took an embryo, he took a chick embryo and used that to investigate whether this exclusion zone phenomena was happening in a living system that is representative of our cardiovascular system. So he shone an infrared light source on this embryo model, and what did he notice? With infrared application, venous flow velocity increased by 30%, beginning almost immediately. After the infrared source was removed, the venous flow diminished below baseline. This positive effect of infrared agrees with the results of previous studies. So what does that mean? And I'm going to pause to really emphasize this point. It means that blood flow is occurring at the level of the microcirculation, irrespective of the pumping action of the heart. And that is frankly paradigm shattering, because the cardiology dogma or prevailing thought and orthodoxy is that the heart operating as a pressure propulsion pump is the sole driver of velocity and flow of blood through the system. What Pollack's work elegantly proves is that the blood vessels themselves intrinsically can drive blood flow through these exclusion zone water dynamics with and driven by infrared light that is being applied to them. It also really has massive implications for thinking about what or why and how we can best optimize our heart health. So the next question that you're probably asking is that where can we get infrared light from? And I'll tell you that natural sunlight has approximately 50% of infrared photons. And this is the spectral irradiance, or the spectrum of light that we get standing on planet Earth. And what you will recognize as the visible light spectrum is only a fraction of the total number of photons or percentage of photons that we get standing on Earth. So we have a smallest, around 5% of light is ultraviolet. And because that light wavelength is short wavelength, it will only penetrate the ozone layer and the atmospheric layers when the sun is at higher angles overhead. And that's why you can only generate sufficient vitamin D below certain latitudes seasonally. You have visible light, and then beyond visible, we get near infrared, mid infrared, and far infrared. So where else can we get infrared light from? So it turns out that your body emits infrared light. And I'm sure you could ask a military soldier who routinely goes on night patrol that they would tell you that pretty quickly. Because the moment they use night imaging and infrared imaging, it's pretty obvious to see a human being. So we are all emitting infrared light, and that is, some of it is heat, but some of it is shorter wavelength infrared light. So what that means is that the infrared light source that is driving this exclusion zone water and this vascular flow is in part coming from the sun, and is in part coming from the endogenous energy that is being generated by your colony of mitochondria all the time, 24/7. So what is this infrared light doing? Well, it's building the exclusion zone water in your blood vessels. And that has two massive implications, which we've alluded to already. One, that it's going to be driving blood flow irrespective of the pumping action of the heart. And two, it is going to be massively protecting the underlying endothelial layer and glycocalix from the contents of the lumen, whether they're red blood cells, whether they're LDL cholesterol, whether they're anything else. So what else? Well, as I mentioned, natural sunlight is a pharmacy. And each one of these wavelengths, visible and non-visible, has a biologically active role in your body. So it turns out that infrared is not the only type of light that we need to be concerned about if we're optimizing our cardiovascular health. Because UVA light has a very important role of liberating the stores of nitric oxide, which is an incredibly potent vasodilator or blood vessel relaxing signal. And it stimulates the release of nitric oxide. So think about the implications of this. If you have high blood pressure or hypertension and you're being prescribed a medication to lower your blood pressure, do you have a deficiency in a calcium channel blocker? Do you have a deficiency in an ACE inhibitor? Or maybe you have a deficiency of ultraviolet A light. Just saying. What else? Well, it turns out that not only UVA, but also blue, red, and near-infrared can influence and potentiate nitric oxide release in our skin and our blood vessels. And the influence of these light wavelengths on our skin physiology and our whole body physiology cannot be overstated. The ability of these light wavelengths to induce release of endorphins to make us feel good, to reward us for ultraviolet light exposure. This is not something you will hear from dermatologists. It's not something you'll hear from your cardiologist. But that is how nature built you. Nature built you to be addicted to the sun. That is what happens to POMC. Protopium melanocortin gets cleaved on, it gets stimulated by UVB exposure, gets cleaved into beta endorphin, and nature rewards you for getting out into ultraviolet light. So the melanoma in southern Sweden cohort, why did the Swedish women who got the most sun exposure, well, why did they live longer? Well, we've talked about that quite briefly, and we can make sense of this. Sun-seeking behavior is UV light harvesting. Every time they went overseas to tan, every time they went and exposed themselves to sun in the summer and the winter, they were harvesting ultraviolet A light, and that was potently releasing that vasodilating substance, nitric oxide, in their blood vessels, and therefore reducing blood pressure and reducing hypertension, which is of the contributors to cardiovascular disease and atherosclerosis, one of the most significant. And they're also harvesting massive amounts of infrared light, which they were using to build that incredibly important exclusion zone water within their blood vessels and cardiovascular system. And that's what they were doing. They didn't know it. They just knew that the sunlight felt good, but they were fundamentally protecting that endothelial layer, that single cell layer inside their blood vessels. So what about skin cancer? Well, this is a paper written by Pelle Lindqvist, and Pelle Lindqvist is the chief investigator of the melanoma in southern Sweden cohort. And what did he say? Well, he said there is an established risk between sun exposure and an increased risk of skin cancer. This risk is further increased among fair women, okay? This is the operant word. But these women seem to have a survival advantage. In medicine, survival advantage means you live longer. So he's pretty clearly told us that although you might and may get skin cancer at a slightly higher rate, you're going to live longer. There seems to be an inverse association between sun exposure and hypertension, type 2 diabetes, venous thromboembolism, which is pulmonary embolism, PE, or DVT, a deep vein thrombosis, cardiovascular disease, and cancer prognosis. All of these effects might explain the inverse association between sun exposure and all-cause mortality. Both vitamin D and nitric oxide seem to be major contributors to the above effect. So this inverse relationship, he's basically told us that the more sun you get, the less likely you are to develop all these diseases. So the problem of skin cancer and sun exposure needs to be framed as a risk versus benefit analysis, just like everything else in medicine. Just like any time your doctor prescribes you a medicine, he or she is balancing the risks of side effects versus the benefits that you're likely to get. And when we think about full spectrum sunlight and we think about applying this framework to full spectrum sunlight exposure, which, let me remind you, was the norm for the entirety of human evolution and human existence on planet Earth. And the onus is on us now to prove to everyone that the sun is necessary and safe, when really we're in a topsy-turvy world that has to justify that. And what are we trading up? Well, we're trading up all-cause death, cardiovascular death, cancer death, and skin cancer death. These women had a survival advantage with a potentially greater number of skin cancer diagnoses. So what did Professor Richard Weller say? And Richard Weller was the investigator on the UK Biobank analysis that looked and proved or showed that the association of more UV light exposure with less cardiovascular mortality. And I'm going to read this because this is how important it is. He says, there is, however, a remarkable absence of any evidence that ultraviolet light reduces lifespan. This is in sharp contrast to other risk factors like hypertension, high blood pressure, smoking and alcohol, on which we as doctors advise. A substantial body of evidence shows that sunlight has health benefits, and these are independent of vitamin D and thus cannot be reproduced by oral supplementation. That means you can't go to the local chemist warehouse and buy a tub of vitamin D pills and expect to extend your life. It doesn't work like that. And the reason it doesn't work like that, he explains, is because the UV-induced reduction of cutaneous nitrate and its export to the systemic vasculature, which he helped delineate, is an additional mechanism. And so that's nitric oxide and the effect of UVA light on nitric oxide. But other mechanisms surely exist. And I think we've discussed, and I personally believe that exclusion zone water and the potentiating effect that infrared light has on our exclusion zone water to drive blood flow and protect the endothelium is the beneficial additional mechanism that Richard Weller talked about back in 2016 when he wrote this paper. And finally, and this is for the doctors listening, all-cause mortality and its reduction should be the primary aim of physicians, not the narrow avoidance of skin cancer. So what does your cardiologist not know about the heart and sunlight? Well, he doesn't know that the blood vessels are lined with fourth phase water, known as an exclusion zone water. This exclusion zone water sits above the blood vessel's endothelial layer and its glycocalix, and it repels these charged blood contents from contacting the cell layer and therefore preventing the initiation of blood clots, which are the mechanistic origin of the formation of coronary artery plaques, arterial plaques, atherosclerosis, and therefore atherosclerotic cardiovascular disease. And the cardiovascular benefit of sun-seeking behavior and the greater UV light exposure is largely due, in my opinion, to UVA light and infrared effects on endothelial health to reduce thrombosis and therefore plaque formation. So we really need to rethink our approach to these traditional risk factors for heart disease, which are smoking, diabetes, high blood pressure, high cholesterol, or atherogenic dyslipidemia. Because really, all of these need to be considered in the context of exclusion zone water disruption, endothelial cell damage, and glycocalix disruption. And I'm going to add that we need to consider sunlight avoidance to one of these risk factors for cardiovascular disease, because that was what the melanoma in southern Sweden's cohort study so definitively showed. And all of these are improved by sunlight exposure. So what does this mean? It means that medications or supplements for heart disease prevention before addressing the health of the blood vessels and before addressing the exclusion zone water is putting the medication cart before the horse. So what do we need to do? And again, this is a message for my colleagues. If you're a conventional doctor, it's not enough to simply prescribe a statin and walk away. If you're a low-carb or carnivore doctor, it's not enough just to prescribe a low-carb or carnivore diet and walk away. And if you're a functional doctor who uses supplements and vitamins, it's not enough to just prescribe these and walk away. Your doctor needs to talk to you about sunlight if they are wanting to prevent you from developing cardiovascular disease. So where can you get infrared and UV light to aid in this blood flow, to build your exclusion zone water and to augment your blood vessel health? Well, I'll tell you where you can't get it, and that is inside. Indoor lighting is profoundly deficient in non-visible light that we get from the sun. The lights in this image are compact fluorescent lamps, they emit a highly unnatural, highly alien spectrum that is enriched in blue and has no balance with red, with infrared, and obviously it has no ultraviolet either. This is a problem. And you can imagine that in our ancestral past, we were outside exposed to infrared light the whole day. And we've gone to a situation where we're indoors 93% of the time. In one study in the US showed from the early 2000s that people are spending 88% of their time indoors and another 6% of that time in a car. So people are getting no natural sunlight, or very less than 10% of their time is getting natural sunlight. And when they are getting sunlight, it's filtered either through windows, through sunglasses, or through other means. And this is a profound deficiency. This is a nutrient deficiency of infrared light. And it explains in very important way the risk and the development of cardiovascular diseases. So where can you get red and infrared light? Well, you can get it early in the morning and late in the afternoon. And that's because the first light that comes on sunrise is enriched in red and infrared, all the longer wavelength light. Then throughout the day, progressively, you get a higher proportion of shorter wavelength light because of the angle of the sun over the earth. And you first get ultraviolet A, then you get ultraviolet B. And nature has made the system so elegantly that the red light and the infrared light primes your skin. It initiates antioxidant pathways in your keratinocytes. It promotes your fibroblast cells to make more collagen in anticipation for the shorter wavelength UVA light, which can cause oxidative stress in addition to nitric oxide release. UVA light also induces tanning, an immediate tanning response in preparation for UVB. So by the time UVB arrives in our ancestral past, in our hunting zones in the savannah, we would have had the proper sequence of light nutrients to prepare us for this ultraviolet light that can be damaging, but is also highly important and highly necessary for optimal health. And this is a photo. This is using a spectrometer from Tristan, who's measured at sunrise, and you can see, although we don't go too much further than red in the visible spectrum, we can see how enriched that morning light is in these longer light wavelengths. And this is potently building that blood vessel exclusion zone water, and it is potently aiding in your cardiovascular health. The other point that I will make is that these infrared light can penetrate through your body up to 10 centimeters. So that means that when you're outside, even if you're wearing a t-shirt, you are going to get a therapeutic and physiological benefit from simply being outside. And that light gets through, and for children or young children or babies, 100% of their cells are able to be bathed in this infrared light. And as adults, because we're bigger, depending on your size, it might be only 60% of your cells. But the point is, this light is absolutely key, and it's essentially, it's free. Mother Nature is providing it for you, for your cardiovascular health, but you have to be aware, and you have to know that it's there for you. So I have just scratched the surface of the effect of sunlight on cardiovascular health. I haven't been able to talk about vitamin D signaling. I haven't talked about pro-melanocortin and the melanocortins. I haven't talked about the mitochondria and the fact that your heart is one of the most mitochondrial dense tissues in your whole body and is massively potentiated and augmented by red and infrared light on a mitochondrial level. And I haven't even talked about circadian rhythms and the fact that even STEMI, or the acute myocardial infarction, the onset of that is related to circadian time of day. So I just want to make the point that this is nowhere near the comprehensive overview, but only a simple outline of how the sun is touching our cardiovascular health. So what can you do? And that is the question, is what can I do now? Well, that is embrace full spectrum sunlight. Expose the skin, particularly to infrared light-rich sunrise and sunset. Build your solar callus. So progressively increase your UV light exposure so you can harvest UVA light and dilate those blood vessels without burning and without coming into risk of burning. And think about heart health and think about heart disease in the terms of blood vessel health and exclusion zone water. And again, there's so much I haven't talked about, and grounding is another topic that is very, very pertinent to this topic that I simply haven't had time to address. But these are all available to you. These are free, and you can use them to your benefit. So if you want to learn more, I teach a Circadian Reset course, and I teach a course about how to harness ultraviolet light in a way that's appropriate for your skin type, appropriate for your latitude, and takes into consideration things like photosensitizing medications and all the important things that might influence your photosensitivity. And I have a private group, and thank you to a couple of my members who've made the trip here. I really appreciate it, and it was great to see you in person. Thank you very much for listening.